right. Good afternoon, Barbara. How are you today?
I'm doing very well, thank you. How are you?
Very good as well. Thank you for asking, and thanks for letting me record this portion of our interview. We have been chatting for quite some time. I feel like we had a great conversation, and now we're going to go ahead and record a little bit of your experience, your skill set, so my clients can hear a little bit about you in your own words. So, Barbara, why don't you tell me a little bit about your current job and what you do?
Absolutely. Thank you. I'm looking forward to having this conversation. My current job is a pediatrician's office. It's located in Volusia County, and I am a medical receptionist. I'm able to assist patients that come in from anywhere between newborn all the way to 21 years of age. It's a beautiful community, and the doctors are phenomenal, and the job itself is a wonderful, fulfilling job when it's working perfectly in a day.
All right. Now, the reason why you're looking, we did uncover that a little bit, is that you have some pretty long hours, like almost 12-hour days, like from sun up to sundown in the office, because you're the first one there, and then you're usually the last one to leave. So, of course, in most positions nowadays, that work-life balance is obviously important. Tell me a little bit about how you manage your day, your day to day, to be able to fit it all in. Because I mean, we all know that we have a lot of things to do every day. How do you keep yourself organized and fit it all in?
Well, I always try to jot things down. I take what's more important, what's a priority, from arriving to the office, opening up the office, turning on the computers, getting everything started for that first patient, which most of the days are already outside at 6:30 in the morning waiting for their appointment. So what I do is I always try to greet them. I have everything ready for them, tablets, registration, anything and everything. Verification of insurances I also do. So I have to have that extra time. So I always arrive a little bit early. I give each patient I give them my full attention, but while they're registering, I'm gathering all of the medical software so that it'll make it an easier transition for them to be seen on a very, very strict schedule, because we have so many patients coming in right after. And so I try to make it so that the MAs, the medical assistants, have what they need so that they can bring the patients to the back, as well as trying to schedule, call, see if there's cancellations. It's a very tight schedule. And at times, if there are patients that do not show up, or there are patients that walked in with a need, obviously we cannot deny them. So I have to make sure I put them in the schedule, make sure they're going to be seen, and that it's not an emergency where they'll need to go to the ER. So I have to have a lot of communication with the back, a lot of communication with my supervisor, a lot of communication with the doctors, chatting them and asking them, what would be the best protocol, the best course of action, so that every person will have their needs met. Within the duration of the day, obviously things do happen, things come up. And after lunch, I try to arrive a little early so that I can get my paperwork and all my labs, things that need to be done for the incoming patients that I have to anticipate. Insurances, is it valid? Will they have a new insurance? How much time is that going to take to put it into the system? So many little things. I have to just make sure that I have those extra 10 minutes to be able to conquer something that I have to anticipate will eventually happen. At times, yes, and at times.
Oh, that's definitely, I would say my next three questions, you've already hit it on the nail on the head there. Super organized. It looks like, based on what you just told me, lots of multitasking.
Yes, lots of.
So what about your computer skills? I know you're probably using a proprietary system at your current job, but what about the Microsoft Word, Office, Google? How do you feel like your computer skills are rated, maybe 1 to 10?
I would say an 8. Say an 8. I use a lot of medical software. We use Google. I'm also an ambassador for my company. So as the community ambassador, I have to be constantly in these Google chat meetings and these other meetings. So I'm constantly having to learn new things. If it changed into another platform, I have to learn that platform quickly because I have to communicate. There has to be communication.
All right, awesome. Okay, well, I think that's about it for this part of the interview. I mean, you're an amazing candidate. You'd be, a great asset to, any company here. So I'm going to go ahead and stop this part of the recording, but we're going to talk a little bit more about specific skill sets to get your profile built.
I appreciate it. Thank you very much.
Thank you, Barbara.
You're welcome.